very helpful.
Oh, Andrew's here now. Hi, Andrew.
Good morning.
Morning.
Morning, Andrew.
Dean, did you hear that Andrew is here?
I did, and it's just
Okay.
about 10 o'clock, so I think we will get the meeting underway since Andrew has joined us. Good morning, Andrew.
Hey, good
My name
morning.
is Dean Labute.
Hi, Dean.
I'm the chair of our CARP Windsor-Essex Chapter Long-Term Care Transformation Committee, and on behalf of our executive board, our more than 2,200 members of this committee, I want to thank you for agreeing to meet with us today and to answer the questions we have already shared with you. I will be calling upon a member of this committee, Gay, to ask you those questions, and we welcome your participation. So, Gay, would you please proceed?
Thank you, Dean. And Andrew, we truly appreciate the opportunity to hear your responses to the questions we previously provided. So the first question is, what is your party's plan to provide a seamless system of home care, long-term care, and palliative care for our increasing elderly population in Windsor and Essex County?
Well, thank you very much for that question. If for anyone who's been paying attention, the budget, we have the seniors stay-at-home tax credit that was just brought in because seniors are best served at home, staying in their own home as much as possible. So home care is vital. Part of the plan, overall plan for seniors and home care especially, to stay in homes that we love. There's a $1 billion investment that's being put forward in a re-elected PC government. The funding will benefit nearly 700,000 families who rely on home care annually. So I know we have a lot in the system, but really home is the best place for recovery and sustainability. So I'm really excited to see that focus on home care and the delivery of services right to your home. It'll also alleviate unnecessary pressure on our larger institutions, which already have vulnerabilities in their own right, infections and just spreading ourselves way too thin on in a given spot. My dad spent a lot of time at Med Hospital, a few years ago when he was getting treated for cancer, and he picked up all kinds of infections when he was in a vulnerable state. That was not something that I'd like to see anybody go through. So it's another catalyst for why it's important to do home care and to ensure that home care is delivered efficiently. The last government has provided $548.5 million over 3 years to expand home care services. So the new investment is quite a bit more substantial than the past number of years. And so a total of about $1.5 billion more in home care and tax credits to make homes safer. So that's what was in the budget just this past year, safer and more accessible. So you can use that tax credit on a lot of home services and personal services too. It could be anything from dental to hairdressing to housekeeping. There's a pretty substantial list of qualifying services that would be tax deductions for you. And beyond that, at a certain point, long-term care is the most important. And I can't sugarcoat it that governments of all stripes have, I'd say, neglected the long-term care system. And we saw the impacts of that in the pandemic. So no one got it right. And, quite frankly, I don't think we got it right either, but it's our responsibility to fix it. And we made the commitment to finally address the situation. So to start off, we introduced the Fixing Long-Term Care Act that established an average of 4 hours of direct daily care in law. We strengthened the Residents' Bill of Rights, and we implemented an annual survey double the fines on convictions for offenses, and double the number of inspectors. We are getting it done for staffing long-term care homes by adding $4.9 billion investment. And this substantial amount is to train 27,000 new staff across the healthcare sector, including personal support workers, nurses, and doctors. And this is staff we desperately need after many years of neglect. And I'll just add in, I've had the opportunity to speak to a lot of different organizations participating in healthcare, especially during this campaign. And the stories I've heard are, just they're not like, I think everyone's got the right intentions, and I understand that we have to get to balance the broader picture. But there's certain things that just you should not sacrifice, and our well-being is definitely one of them that we need to make sure that government is focusing on what matters, and what matters is health and long-term care. In addition, this government is building an additional 30,000 beds across the system. My campaign office is just about 2 blocks away from one of the beneficiaries of that, Bruyette Manor. It's received a substantial amount of provincial funding for its rebuilding and increase in beds in that facility. I'm delighted to see that right in my own neighborhood. And we've surpassed our goal of building in the past. We had a set goal of 31,705 new and 28,648 upgraded beds. Sorry, the number of upgraded beds is what's in the pipeline. So we built 30, and we're going to get to another 30 under the next number of years. You know what? We only saw 611 beds built under last government, and between 2011 and 2018. So we haven't seen a substantial increase in the number of long-term care beds until the Doug Ford government came to be, and really looking at our competitors too. The NDP's platform, they would cut funding to long-term care from the historic levels that we had put forward as the PC government. We've exceeded our proposed increase of 30%, and we want to invest that money into the system sooner. Home Care Ontario, as an organization, they're very happy with the government's announcements on home care and the investments that are necessary. So maybe I'll leave it there. I could go on further though, if you wish, but I'll park it there.
Yes. Thank you, Andrew. I will ask a further question there. This question was about the system, so that say that I'm a person who am receiving home care, but it's getting to the point where I'm not being provided what I need, and I'm having to look at transitioning into long-term care, and then maybe later even transitioning into palliative care. Are you and your party happy with the current system the way it is, or do you see that there could be some changes made to make it easier, to make the transitions easier?
You know what, as a candidate, look, do I know the system inside and out? No, and I'm not destined to until I become elected. But one thing on a broader perspective, when it comes to the coordination of healthcare services, we've seen efforts to improve. I'll give kudos to the Liberal government of the past. They introduced the local health integration networks and community care access centers in an effort to provide that seamless transition between the different services so that you have more of a patient-centered care. But it didn't work out very well. It added a lot of bureaucracy, but not a lot of frontline services. So this government has begun an evolution to the Ontario Health Teams, which involves our local organizations. Instead of a different bureaucracy, we're actually involving our local organizations, and they're working together. So, the Mental Health Association, Hotel Dieu Grace, Windsor Regional Hospital, and they will basically get the pot of local funds and understand where the local issues need to be. Everyone would take the lead on coordinating, a local body. That's the vision that exists. And so instead of having a disconnected organization that's foreign, and foreign to our community, not so much foreign like overseas or anything, but we'd have a local group that would be tasked with the improvement of the service. And so I hope that answers your question as much as I can. But in terms of anything more specific than that, our platform does not make any specific commitments to a certain system beyond what I've described.
Okay, thank you. What specifically will you or your party do to help more seniors stay in their homes? I think you've kind of covered this in the first in your response to the first question, but do you have anything else you would like to add regarding that?
Yeah, I definitely would. Under the Ford government, free dental care was brought in for low-income seniors, 65 and over. So that helps about 100,000 people across Ontario. So you know what? That's a cost that doesn't need to be borne by low-income seniors. That now can be reinvested to allow seniors to stay in their home. I mentioned the Seniors Home Safety Tax Credit. That's a refundable tax credit of about $2,500 or of up to $2,500, which will absolutely help seniors stay in their homes longer. The 2-in-1 hotline, which is our window to government services, it's certainly been it's got a set of standards that are intended to be senior friendly, that the operators are trained to ensure that seniors can call that hotline and be provided with the services or the direction on the services that they're looking for. There's also been significant investments in deliveries during COVID. 1.5 million deliveries were made to seniors of food, medicine, and other essentials for those who are isolated in their homes. So I would say those are some additional items that I'd like to mention, but I'd say the catalyst is number one, the staying at seniors home safety tax credit, as well as the lift tax credit. So that isn't specific to seniors, but certainly seniors who pay income tax or might actually be able to avoid it now. Anything under $50,000 would get that $300 deduction off the top, which would reflect their tax, their tax bill otherwise. So that's money that could be reinvested in your staying at home.
Thank you. Question 3. What is your vision for long-term care? Specifically, we would like you to comment on how your plan will provide a quality and stimulating environment that is based on the individual needs of seniors.
Okay, well, interestingly enough, we actually have a fair focus, not necessarily in long-term care centers specifically, but on seniors activity. So for example, the Ontario Community Support Program, not the Community Support Program, the Seniors Community Grant Programs, there have been $6 million invested just for 2022-23 in helping seniors have healthy and active lifestyles. So that's, it's key. I mean, even town of Tecumseh, where I'm a counselor, we've been working to develop a sportsplex or a sports complex with an indoor walking track. I know the seniors of the community have been always turning to me looking, when is it coming? When are we going to have that opportunity to have that active facility? So I'm well aware of how important it is to be mobile. And my grandmother lives in assisted care. And I know how isolated she's been in the last couple of years. With what she's gone through. It's really heartbreaking, honestly, for there's no perfect path to getting someone healthy under these circumstances. If you're staying in your room because there's a virus out there, that means you're not active and you're not able to really take care of yourself. So in my attempt to actually answer, I would say we certainly want to make sure the long-term care homes are well regulated, with respect to our expectations of service. If they're receiving public money, they should be, we really do need to ensure that they're following all of the protocols that the government has put forward. So inspections is one area where this government is making some changes. There will be 3 pillars on that: staffing and care, accountability, enforcement, and transparency. And so part of that too is building new facilities, like I mentioned, Bruyette Manor. The old stock just isn't working, and the new stock will be including a lot of amenities, such as just to provide for that change of mindset. It's not about housing. It's not about warehousing people. This is a community. This is a lifestyle, and we need to support those lifestyles. And certainly to build that, the added inspections, we want to build that trust that those who are most vulnerable will be safe and enjoy the quality of life that they deserve. And so these inspections do play a critical role. Investment $20 million in additional inspections, about 193 new inspectors that are going to be hired by this fall. And that's going to be double the amount. Currently, under what was inherited was 156 inspectors when this government took office, and now we're going to have 344. So that one, beyond that, I'd say the platform does not have a specific item about relevant to your question, but I hope this has provided a general overview of the vision of how we intend to through the system, ensure that we are able to achieve the goal that you're seeking.
Okay, now I would just like to comment that it is important how many inspectors we have, but more importantly are the inspections being done? And they weren't done during the pandemic. Am I correct?
Yeah, well, now my understanding is that when the Liberals moved to the risk-based system, that basically they were looking for the bad apples and trying to focus their efforts there, which I understand why. But then, if COVID hits and your inspectors are not showing up, then they're not witnessing what's actually happening on the ground. So this is definitely an issue that came forward during the pandemic, and whether it's through the collective agreements or through the general management of the inspections program, that's not where we needed to be in that situation where we needed inspectors and they were not doing it in person, but there is personal risk. And so this balance is, it's just one that has to be managed through collective agreements with the staff. And what is it that we are expecting the staff to take on, and what risks that we're expecting them to take on, and what's the consequence of that in terms of the labor management relations. So I understand what you're saying, and I wish I could give you a clear answer. I work for government. I understand that these things are sometimes happen, and no one sees them coming. And so when you find when this happens, you identify the problem and try to fix it, but sometimes you just don't see the problem until it hits you.
Okay, thank you. Moving on to the next question. What is your party's plan to attract and retain healthcare workers in home care and long-term care? And what staffing client ratio does your plan include?
I'll say the front end, I don't have a figure to provide on the staffing ratio. The last thing I want to do to you is to give you a false commitment. And I think you need to be able to trust your politicians and that they're going to tell you I don't know when they don't know, and not just make stuff up. But what I can tell you is that we absolutely will seek that 27,000 additional the additional personal support workers, doctors, and nurses. It's vital that we have more capacity in the system. We witnessed the workforce and what was happening there. We witnessed the people leaving the profession, and happily, we've learned And so actually nurses actually, first off, they did a heck of a job. And for those who stuck around and they put their heart and their soul into this, they had to live COVID through thick and thin, not just at work, but at home too. It's just not, just no one can really appreciate what they went through until this happened. And I certainly want to give my thanks to them. They've stayed on the front lines through selflessness. And that's what I truly value. And so we are providing $764 million to our existing nurses to help retain them in the system. So that works out to about $5,000 as a retention bonus. Say, please continue your nursing career because we need you. We want to show our thanks and our support to the nursing staff. And we also want to make sure that they are well taken care of. I hear a lot about Bill 124, which this government passed. It affected all public sector workers. It was in a time of economic deflation and high deficit. The choice of the government was to put a 1% a cap on salary increases at the top end. That didn't stop grid changes, or there's the 8-year grid that a member of the staff goes through. So you could still get your annual increases as you're going up the grid. Just if you're at the top of the grid, the 1% ended up hitting you. During the pandemic, in addition to that retention bonus, there was a $12,000 salary top up for the average nurse. So this is something that is. It's a gesture. I think there's more to do, obviously, but we wanted to make sure that the nurses are supported and were demonstrably supported. So 61 million was added to support building up our nursing workforce. So 18 million for the Ontario Nursing Graduate Program. So that provides full-time salary and benefits for over 600 nurses with a focus on recruiting in areas of need, particularly acute and long-term care. Another 8 million was used to add 800 nurses to the healthcare system in target areas. So where we knew that there were some deficiencies, that $8 million fund was used to add. There's $35 million added to increase the enrollment in nursing education programs in our public colleges and universities. So those are new spaces. They started in fall 2021 and winter 2022. And now they're going to introduce, just as part of that program, we'll have another 1,130 new practical and 870 registered nurses into the system. And finally, a $342 million fund over 5 years to strengthen the nursing workforce by adding over 5,000 new and upskilled registered nurses, as well as 8,000 personal support workers to critical areas. So in large part, this is, we do need to staff up and the game plan is there to make sure that we get there. The investment is there in the budget. Now, hopefully we pass this year's budget so we can get going. But it's definitely in our plan to bulk up on our nursing support and our nursing staff.
Okay, Andrew, we'll now move on to our last question. As an electorate, how do we know you will put your plan into practice? And what are your specific timelines and benchmarks for the implementation of the changes you are promising for home care and long-term care?
Yeah, no, you know what? As an electorate, you don't know, and I'll point to something that I've tackled on town council. So in the 2015 election, nothing really to do with the topic at hand, but we had a Liberal candidate who said, elect me and elect Justin Trudeau. He's not going to cancel your home delivery of mail. Well, in Tecumseh, we had our home delivery of mail that ended. Despite the fact that the now Prime Minister, was elected, the promise never made it through. And you know what? I'll be quite blunt. I'm an 8-year town councillor. In 2014, I ran on 3 items, one of which was under my control, and 2 were things I wanted to fight for. Of the 2 things I wanted to fight for, I made it 90% of the way, but unfortunately, changing priorities meant that something else jumped the queue. Providing housing over people's heads jumped the queue over improving some of our roads. And that is definitely a situation that you're going to run into. I don't know. I know we have the intent to put this plan into practice. It's in the budget. The funds are being allocated, but you never know what's going to hit you as an elected official. You never know what will jump the queue. So I don't have specific timelines and benchmarks to offer. What I can offer is that what I've shared is our plan. We do not intend to deviate from it. This is where we think we need to go. And I'm willing to learn and to listen to see if there's a tweaking and a way to improve. But I think anyone who does provide you with that level of specifics just is unaware of what government is and how it operates. But as a local MPP, I would be part of a government, and as opposed to an opposition MPP. And I'm the best suited to make headway on the issues that are raised, especially you'd have a local voice in the government of Ontario. I do believe Premier Doug Ford is getting reelected. And so I expect that you will end up, I know you will end up with a very caring and compassionate and responsible MPP who will return your calls, who knows the system, who knows what he can and can't do, and would be your conduit to the provincial government. And you can be assured that the feedback that you give to me in my position, if I'm chosen as MPP, it will make its way up and be part of the discussion and be part of the overall considerations of government.
Okay, thank you very much, Andrew. I'll now turn it back over to Dean. He probably has a few closing statements to make. Thank you.
Andrew, thank you very much. Before I call upon Henry to thank you formally on behalf of our group, I did note that you made reference to the budget, but you are cognizant of the fact that the budget was introduced in the Ontario Legislative Assembly, but then Mr. Ford went to the Lieutenant Governor to have the House dissolved. Yes. The budget was never passed, so it was presented but not passed. When questioned by the media, Mr. Ford did not commit to reintroduce that same budget if the Conservatives formed government post the 2nd of June election. Based upon your inside information, has the Ford government made an internal commitment to reintroduce that same budget, or was that just something put up in front of the public and be changed post-election?
No, the budget was introduced, and yes, the Travis Kahn, the Premier's communications manager, did confirm the same budget was going to be reintroduced. We have since made a separate commitment that wasn't in there to help support the Ontario Disability Support Program, which did not appear in that budget. And so that change is destined to be included under a new budget. But beyond that, it is certainly every indication that I have and the commitment that has been published by the Premier's staff is that this budget is getting reintroduced as had been put forward.
Okay, because that is not what was in the media following Mr. Ford going to the Lieutenant Governor. So it's good to know that they're going to continue with that commitment with the adjustment you just made reference to. That's very good. So at this time, I'd like to call upon Henry to thank you on behalf of our committee. Henry?
Good morning, Andrew.
Hey, good morning.
I'm on iPad 10. And on behalf of Dean, Anne, Sandy, Gay, Pat, Donna, and Larry, I want to thank you for joining us this morning and for adding your comments, your thoughts, your philosophy, and particularly your party's platform with regard to these serious issues for seniors in Windsor-Essex and indeed across the province. May I also conclude by wishing you well on behalf of the group in the upcoming election. Thank you for joining us.
And thank you very much for having me. I was a delight. I know seniors are very important to me. My mother's a senior, my grandmother's a senior, and I get to see certainly more of the challenges on my grandmother's side, but I got to hand it to seniors too. They have weathered the worst of all of this. I couldn't even imagine the isolation and the loneliness and the difficulties of the last couple of years, and how difficult that would have been for so many seniors in our community. And I recognize that. And one of the things that's exciting about this opportunity is to be part of that post-pandemic recap or rethink of what went right and what went wrong and what we need to work on. And to be able to be there to contribute to that, to making sure that we don't have to resort to those things again, or at least finding every possible way to do that. That's a really exciting opportunity that I'd love to be a part of. And you know what, I say seniors are, they've worked very hard in their career. They've worked very hard to provide and build our overall society that we have. And so they certainly are owed the dignity and respect of their lifetime service, and we need to make sure that they're well taken care of. And if anyone has,
hey, Andrew, well, thank you very much for your comments. We wish you a good day and good canvassing.
Okay, thank you very much. 226-839-2442 is my phone number.
Thank you, Andrew. Bye.
If you want to repeat that so we can understand it.
Yeah, 226-839-2442.
Thank you, Andrew.
Okay, all right. Have a great day.
Bye-bye.
Thank you.
Bye-bye.
Bye-bye.
Okay.
Has Andrew left us?
Yes, he's left.
Okay, very good. How much time before Ron joins us?
2 minutes.
2 minutes. We got 2 minutes to spare. Any thoughts or comments?
He was obviously was well informed. And he didn't make any promises. He said he couldn't keep, so he seemed honest. Donna, you're muted. You're muted, Donna.
I've talked
Straightforward.
to nurses, and not one nurse has seen $1 from the government yet. Not one. So that's blowing hot air as far as I'm concerned. And from my experience, he's a good talker. I'm not sure he's a good actor. I don't think he's going to act upon what he's a typical politician as far as I'm concerned, but he won't get my vote. But anyway, there we go. Ron's on.
Ron's coming on.
Okay, thank you very much.
Okay, Ron is with us now.
Good morning, Ron.
Good morning. How are you?
I'm fine. Ron, my name is Dean Labute. I'm the chair of the Long-Term Care Transformation Committee of the CARP Windsor-Essex chapter. And on behalf of our board of directors, our more than 2,200 members, and this committee, I want to thank you for joining us today and then agreeing to answer the questions we have already shared with you during this session. Therefore, I will be calling upon Gay to ask you those questions. Gay, would you please?
Yes, thank you, Dean. And good morning, Ron.
Morning.
We appreciate the opportunity to hear your responses to our previously provided questions. So I will begin with question 1. What is your party's plan to provide a seamless system of home care, long-term care, and palliative care for our increasingly elderly population in Windsor and Essex County?
So the New Democrats have developed a very comprehensive healthcare platform. It's a continuum from, I like to say, from the moment you call ambulance to the moment you need end of life care. So what we're looking at improving first off is home care, because we are aware that seniors have indicated that their preference would be to stay in their home as long as they can. So because of that, we also know that we can provide effective, efficient home care supports at a much in a dignified manner that is more cost effective than having people move to a home or an institution that they're not interested in moving to, right? And I hear it on the doors too when I've been in various locations where there's seniors. Seniors want to stay in their homes. So that's our number one goal. The second thing is in terms of that transition to long-term care, the NDP is very committed to reducing the ratio, although I don't have the specific numbers, but reducing the ratios in long-term care homes between patients and the support workers. My mom was in a long-term care home during COVID, and I saw how hard the staff had to work to try to just get the meals and follow protocols, let alone provide any kind of, interaction or, care, social interaction care. So we will be increasing the number of staff. We would be looking to transition to a nonprofit model for long-term care. And it's interesting, I had a meeting with Hotel du Grace 2 days ago. They actually have an application before the province to build a 192-bed long-term care home at the Tafer West campus on Prince Road. So that's a nonprofit application. That's something that we would be very interested in moving forward.
Thank you. Question 2. What specifically will you or your party do to help more seniors stay in their homes?
Okay, I touched upon it a bit. Obviously, right now in Ontario, it's almost impossible to get the 4 hours per week that are available through programming because there's a lack of PSWs. There's a lack of trained personnel, and so what we have to do is we have to make the PSW world enticing for people to want to come and work. They're underpaid. They're overworked. Again, touching on when my mom was at home before she went into long-term care. I talked to the PSW that came in, and they're literally running from one spot to another, and they have small gaps in time to actually get to where they're going. So we need to increase the number of PSWs. We have to pay them appropriately to ensure that they're enthusiastic about their work, that we want to make sure that the ratio increases the number of hours. So I don't know how many of you saw the CBC report on home care in Denmark. They get up to 10 hours a day. We're struggling to get 4 hours a week. So we definitely need to do better. And again, our platform is very robust in terms of how we're going to hire more staff and how we're going to fund home care and ensure people can stay in their homes as long as they possibly can.
Okay. You're saying 4 hours a week, but is it not 4 hours a day that we're struggling to try to reach?
I thought it was 4 hours. Maybe I misspoke, but we are definitely struggling, and we're certainly not at the 10 hours a day like Denmark has. We definitely need to make sure that people have home care for the appropriate amount of time that they need, not some regulated cap, because every person's different and every person's needs will likely start at one point and move along as they grow older, right? Some care might be as simple as, going in and doing some, prepped meals for a week, at the outset, but then later they need some house cleaning. They need some, personal care, right? It goes up. So we're looking at making sure we can provide a much more robust approach to home care.
Right. And I understand too that some organizations are using different calculations to arrive at how many hours an individual is receiving, and including, like, for example, administrative, like the office workers and the kitchen help, into this time frame, which, I think 4 hours directly to each individual is the minimum that should be going on. Okay, so now we'll move on to question 3. What is your vision for long-term care? Specifically, we would like you to comment on how your plan will provide a quality and stimulating environment that is based on the individual needs of seniors.
Okay, so I touched on a little bit. We want to make sure that we're redirecting all of the income back into the homes to ensure staff has the right ratio to actually have some social time with their client. We're also going to fund the money back into the home to ensure that the homes are appropriately outfitted and are an environment that people are comfortable to work in. Right now, we have a model that, the PSWs are stretched to their limit because at the end of the day, the goal is the profit at the end of the day, right? How much money does the shareholder get? When I was on the doors recently, I was talking to an individual who has a mother in a rest home or a long-term care home in Arizona, not for profit in Arizona, which shocked me, to be honest with you. And he talked about how wonderful this not-for-profit was in Arizona and how the staff are engaged. There's no staff turnover because they're well paid, and there's the staffing level is very appropriate. So there's a huge community. We want to make it feel like you're in a community, not in an institution. That's one of the real keys from my perspective. You know what, again, going back to my mom, the experience I had with my mom's stay in a long-term care home was very short, and it was only during the pandemic. And I got very limited interaction with her because of the restrictions. But I do know that I did know personally that the one of the PSWs that is assigned to work with her, and how I talked to her and how she was just run off her feet and part-time work and having to work at multiple homes. It's just not appropriate. So we need to build a very strong long-term care support network that's based on putting all revenues into the funding the home, not profit. So again, I explained that example that Windsor or Grace Hospital, Hotel Dieu Grace Hospital has a plan for 192 beds for Windsor. It's a $10 million investment by them, and it's a not-for-profit home. We want to see those types of opportunities grow, and we will focus our licenses on those nonprofit opportunities.
Okay. What is your party's plan to attract and retain healthcare workers in home care and long-term care? And what staffing client ratio does your plan include?
Well, I'll start with what I don't know is I don't know the official staffing ratio, but I can tell you that it will be something that works well for the patient as well as the staff. The thing we're going to do to attract the staff is, one, is we have a plan to hire 20,000 nurses across the province. Some of those obviously will end up working in long-term care. But one of the real keys is if you want to have stability in long-term care is you need to make sure that your staff wants to be there and feels that they're connected to that community, right? Or to that home. And we are going to do that by creating full-time positions, not part-time positions, so that are well paid. So at the end of the day, the PSW doesn't have to rush to another home to work 4 hours or go work at a variety store to make ends meet, right? We need them to be focused and fully energized when they go in for their shift. And if we do a nonprofit model, we're able to pay people more money and ensure that they're going to stay for a longer period of time and enjoy the work. And if the work isn't so overwhelmingly draining because they're tending to 15 people on a floor by themselves, then they're going to have a more enjoyable experience, and that will translate to the patient. I mean, again, you know, my experience inside a long-term care home is very limited, but I saw how much the PSWs I saw cared, but I also saw how little time they had to actually commit to social interaction.
Now, as an electorate, how do we know you will put your plan into practice? And what are your specific timelines and benchmarks for the implementation of the changes you are promising for home care and long-term care?
Right. Well, my own personal commitment is that I spent 30 years in policing as a police officer for 30 years. And one of the reasons that I'm running in this election for the New Democrats is I've seen in my 30 years, I saw repeated or successive liberal and conservative governments continually fail to address social policy needs. So for me, a lot of that was about homelessness, addiction, and mental health. But it also transitions to the fact that I was spending a lot of time at the hospitals for calls for service. And I could see how broken our social policy network had become. So that's why I'm running, is because I believe in the very robust healthcare continuum commitments that we have. In terms of one of the first things we're going to do is we're going to repeal Bill 124, and that will allow us to enter into appropriate negotiations with nurses and not have them working under a cap that artificially limits them from engaging in collective bargaining. That's a key point to attract more people into the healthcare sector. We've had many people driven out during the pandemic because of Bill 124, but also the ratios, right? People just overwhelmed at long-term cares in hospitals. So we're committed to moving on day one to start the ball rolling. I would certainly be advocating on day one for the 192 beds here in Windsor. We need more beds, we know that, and we need to start attracting people with appropriate wages and benefits.
Given that you have now responded to our 5 questions and we have some time left, Ron, would you be willing to respond to 1 or 2 more questions from our chair, Dean Labute?
Certainly.
Dean?
Ron, thank you for that. I have 2 supplementary questions for you. The first one dealt with the number of deaths of seniors in long-term care following the second wave of COVID-19 in Ontario. As thousands of seniors were dying in long-term care, the Ford government moved quickly and introduced and passed into law Bill 218, commonly referred to as the Supporting Ontario Recovery and Municipal Election Act. What it did, it provided a shield of protection for the owners, the investors of long-term care and retirement homes. If the NDP forms government in following the election, will you move to repeal Bill 218, so that those people need to go before the public and be subject to paying the cost for the injustice that was put upon our seniors.
So the answer to that is I was on a candidate call this morning, and that's going to be announced by us this week. We will be committed to repealing that. It's inappropriate that businesses that are for profit are shielded from civil liability for their neglect, if it can be proven, right? So we know 4,000 people died in long-term care during the pandemic. We know that we had to call the Army in to help, and we heard the horrific stories the soldiers told us about. But yes, 100%. That came up this morning, and I believe Andrea will be announcing it in the next coming days, if not today.
Okay, very good. Thank you for that. The second question deals with budgeting. In Ontario today, we have more than 700,000 Ontarians being recipients of home care. At the same time, we have approximately 70,000 Ontarians residing in long-term care. And yet, when you look at the budget figures, 87% of the budgeting goes to long-term care, and only 13% goes to supporting home care. Would an NDP government address this inequity in funding?
Yes. So one of the priorities that I started off with this morning was the fact that we know seniors want to stay in their homes longer, and so we will be committing investing many more dollars into that sector, because we want to support seniors as they stay in their homes. We know that if we're able to support somebody to stay in their home longer, the government's not paying for the infrastructure of where they're staying. You're simply providing service, and so that can be provided in a much more efficient and effective manner. And if that matches the need of the senior, it only makes sense. I don't know why other governments haven't seen this, but yes, 100%. Home care is a pillar in our platform, and we are committed to increasing it. In terms of budgeting, we have a fully budgeted platform, which you can see on our Ontario NDP website. We anticipate we're going to run a deficit of $2 billion more than the Conservatives have tabled. But we're going to be investing in healthcare and in home care, but not in highways. Actually, Andrea came up with what I think is a brilliant idea to the highway issue in Toronto. She announced that they're going to waive the tolls for trucks that travel on the 407 to get rid of some of the congestion on the 401. That can happen immediately. And we don't have to build a $10 million highway or $10 billion highway, because the 407 is underutilized. So it's about, when you make your budget allocations, it's about priorities, right? We don't need to spend $10 billion on highways in Toronto. We need to be investing in people. And I tell people at the door, that's what I believe in. We need to invest in people. I 100% support the new hospital in Windsor, but unless you build it to provide the services with the people that you require to provide those services, it's just a building, right? The people make the hospital. So, and the people make the home care. By having people that are truly invested in home care, that makes the experience better. By having people truly invested in long-term care support, and that makes it better. The building doesn't make long-term care. The building doesn't make a hospital. People are the key to all of this.
Thank you very much for that. At this time, I will call upon Henry to formally thank you. Henry?
Okay. Thank you, Dean. Good morning, Ron. It's
Morning.
Henry Johnson on iPad 10.
Yes, sir.
And on behalf of Dean, Anne, Gay, Pat, Larry, Donna, and Sandy, I want to thank you for joining us this morning and sharing your thoughts and your particular philosophy based on people with us. These are important issues, as you know, for seniors in Windsor and Essex, and indeed across the province. And we appreciate you taking the time to share, as I said, your thoughts with us. May we also wish you well in the upcoming election. Thank you.
Thank you. If I could just conclude, for those,
Please.
As I said, I believe in people. When I was on the Windsor Police Service, I pushed very hard. You may recall the chief of police was against Narcan being deployed in the streets because he didn't want to provide healthcare in the streets. I was a senior leader of the organization, and I pushed and I pushed and I pushed, and I was overseeing the cell block where, you know, we have our prisoners come in on a day-to-day basis. And I fought until I got it put into the cell block. And that was the first step in now getting it deployed on the streets. And it is deployed on the streets. So I'm not afraid. I am not afraid to fight for what's right. Even though most people, I think a lot of people are surprised that officers running for the New Democrats. And I'm doing that because I care about people. And I believe the NDP has the best plan to provide the supports people need. So,
Okay, Ron, thank you very much for that, and good canvassing to you.
Thank you. Take care.
Thank you.
Bye
Ron.
now.
Bye, Ron.
Bye.
Okay, he's gone, Dean.
Okay. Henry, any thoughts?
I thought the man was straightforward. I thought he used his experience as a policeman to indicate how important it is to put people first. And I believe that what he was saying was what he would do.
Very good. And your thoughts?
Feel the same.
Okay. Gay, your thoughts?
I go right along with Henry. That's the way I thought. Mhm.
Donna?
Yes, I was impressed. I think we should have went one step further perhaps and thanked him for bringing that in control on the streets for our drug addicts. But yes, he was great. He was great.
It was very good. Okay, Larry?
Yeah, well, I vote NDP, so I was naturally inclined to him, but I was also surprised and skeptical that a 30-year police veteran would bring that sensitivity. And of course, his closing statement on naloxone and street treatment impacted me because of my own son's overdose death on the streets 2 years ago. So that was a good closer for him, for me. Thanks.
Indeed. Okay, Pat?
You're muted, Pat.
Oh, she's
That's
she's
right.
making
Sorry, forgot. Yeah.
yeah.
I
she's
think
I'm sorry.
Ron's your neighbor, Pat, is he? Is Ron your neighbor? Yes. Sandy and Pat and I met Ron when we attended the DER Commerce Meet the Candidates at Fogalar, and he spoke very well there as well.
Oh, very good.
Mhm.
Okay, Sandy, your thoughts?
So I agree with what everybody has said. I wish I was in Essex so I could vote for him. He's a person who I really do believe, like Henry said, what he says he's going to do, if he's given the opportunity to do it, he will do it. And I give him a lot of credit. He could have retired with a very good owner's pension, and he's choosing to do this. And that's just incredible. That speaks a lot about our kind of
Yeah, no, he's a very credible candidate.
His heart is in it.
I do wish him well. Okay, our next session commences at 2 p.m. this afternoon. We will all phone in at 1:50 to be ready for our first candidate. We have 3 this afternoon, and that will conclude our week of interviews. So we're entering the home stretch, and I'm impressed with the work of this committee. So well done, everyone, and we will talk later today.
Okay.
Thank you, Dean.
Enjoy your
Thank you,
lunch.
Dean.
Okay.
Take
Thank
care.
you, Dean.
Thank you.
Later.
Thank you,
Okay.
Dean.
Bye.
Bye-bye.
Bye,
Bye-bye.
folks.